The use of asbestos, a leading cause of lung diseases such as lung cancer, asbestosis, and malignant mesothelioma, has been banned in Korea. Currently, occupational and environmental asbestos exposure has become a serious concern, and research is needed to determine whether asbestos in soil or air, both outdoor and indoor, is actually a risk factor. Furthermore, we have little information on asbestos burden in patients with lung cancer or on the characteristics of asbestos, such as length, width, and aspect ratio, that increase cancer risk. Now, scientists from the National Institute of Environmental Research Korea have investigated the effects of environmental and occupational asbestos exposure on 37 lung cancer patients who were due for lung resection surgery. Asbestos exposure was determined through a pre-surgery survey. After obtaining lung tissue during the surgery, scientists used a novel digestion pre-treatment method to help them identify the size and shape of inhaled asbestos under transmission electron microscopy. The main factors affecting the amount of asbestos in the lungs were found to be a history of asbestos exposure, occupational or environmental, male sex, and old age. Additionally, asbestos fibers of a longer and greater aspect ratio were identified in the lungs of patients who had been occupationally exposed than in those who were environmentally exposed to asbestos. The types of asbestos detected in lung tissue were chrysotile, amosite, crocidolite, tremolite, and actinolite. These findings indicate that environmental asbestos exposure also poses lung cancer risk, and this can help improve asbestos control policies of the Asbestos Safety Management Act and the Asbestos Damage Relief Act, which are Korean policies for asbestos management. Currently known asbestos exposure diagnosis methods determine asbestos damage relief by estimating indirect asbestos exposure based on results of clinical examination and chest-computed tomography. Therefore, this new method can set an important basis for determining more effective asbestos damage relief by directly determining asbestos exposure more accurately than previous diagnostic methods.